Hello, back today with a back care routine, all part of the back care series, which is incorporated with a balanced 5-pillar system that is all about building and maintaining a strong, athletic, pain-free body. The emphasis is on health and longevity, and of course back care speaks for itself. It's great, you want to take care of your spine health. These kind of routines are great for active recovery. They help keep you loose and aid that recovery from your main workouts. Also, sedentary lifestyle, long periods sat down can cause imbalances that can lead to aches, pains, niggles, all that kind of stuff. So yeah, give this a go and you should find it beneficial. You should feel no pain in any of these moves. Obviously, pain is a warning sign, so you want to stop. But yeah, give them a go and just see how you get on. So the first one we're going to look at is the child's pose position. So I'm on my hands and knees. I'm going to bring my glutes, which is my butt, back towards my heels, and I'm going to ease my forehead down towards the mat. So again, it all depends where you're starting from. If you're nice and loose, you'll get right down there. I can feel a nice stretch in my lats and a little bit in my lumbar. And the lats, obviously, if you spent hunched over, we want to get into this thoracic vertebrae. So that may be tight. We call this, for the desk jockeys, we call this. Train a lot of guys that sit at desks all day and have these imbalances. So give this a go. You'll be a bit consistent with it. If it's a bit tight, just stick with it, but don't force it. No pain. So I'm going to hold this position now with the breath. I'm going to come forward. I'm going to eyes up. Breathing is a big part. We've got a breathing series as well, because if you're not relaxing into your moves, you're never going to release that tension and it will just move somewhere else. So the key is learning to relax as well. All about body and mind. So you can do between 5 and 10 moves. So I'm going to do 5. This is 3. 1. 4, eyes up to the sky, get the vertebrae in your neck as well. Again, you may feel a stretch, that stretch in your back and your abs, but there should be no pain, so you're not forcing any of these. Okay, now the next one, I'm going to look at the cat and the cow. So for the cat, I want my arms in line with my shoulders, similar to what we do with our planks. That way it's easy to find your alignment. Engage your core with perfect alignment, then with good alignment, engage your core, and that'll take care of your back as well. So we're just holding, crappy planks, all that kind of stuff. So anyway, yeah, from this cat and cow, so my arms are in line with my shoulders. I'm going to look down, I'm going to dig the claws in like a cat, and I'm just raising my shoulders up, which is my trapezes, top of my back, all across the shoulders there. And then I release that one, and as I release it, I'm pushing my coccyx, which is my tailbone. I'm easing it backwards, but I'm not moving it. So it kind of looks like this. You're moving it backwards, but you're not moving the body backwards. So it's these pelvic tilts that are also in our alignments video. And the pelvic tilt is a big part of, for pain-free movement. Like if you've got issues and not a lot of range of motion in your mobility in this pelvic tilt, then that may be why you have back issues. Okay, so that's just a good move in itself. Just get that pelvic tilt moving. It's a little bonus one there. So anyway, so as I push that coccyx back or up, even up towards the ceiling, I'm looking up, eyes up, get the vertebrae in the neck so I can feel my abs and my back. It's called a Pilates zip there with the breath. Cat and cow, eyes up, get that pelvic tilt, pushing the coccyx up. Go between 5 and 10. I'm going to finish there because you get the idea. Okay, now from there, I'm going to look at a bit of rotation in my back. So I'm going to go palm up, right palm behind the left arm. And what I'm looking to do, I'll show you from a different angle in a second. I'm just trying to get this ear and shoulder towards the mat. Now, if you're really tight, you might not be able to get down there. So I feel a lot of these are tight and awkward. Like I say, just ease with them and stick with them. A bit of consistency. Do this a couple of times a week, 3 or 4 weeks, and you'll really notice the difference. But if you are finding a lot of them are tight and restrictive, you're restricting your range of motion. That is why you have some of these tightness, aches, pains, niggles, all that kind of stuff. So as I'm saying, modified, even if you just get to there, don't force it. You want to rotate from your rib cage, your upper back, not your lower back, not the lumbar. So just test it out. And over time, you'll get lower and lower and lower. And eventually, when you get down here, we're going to hold that for a big breath in and out. So that is the aim, without forcing it. You can build up to that. So once you're there for both sides, we'll add a little progression to that. My guys, you'll be ready for this. So when we're there, all I'm going to do now with the right arm is come in up, and I'm going to look along. An extra stretch there, extra movement. Now it's the right one down, left one's coming up. Look along, don't force it. Yeah, feels great. Now from there, I'm going to lie on my front and we're going to look at the lying bird dog. Now, looking down again. So every time I'm looking up, I'm hitting that vertebrae in my neck. That is why that cat-cow is so good. It hits every vertebrae in your spine, great for spinal health. So on this one, it's opposite arm and leg. And from this angle, you want to try and keep the leg straight so you get a bit of hip as well. So you shouldn't be bending that knee. So look down, left leg, right arm, look up. Left arm, right leg, look up. Again, alternate 6 to 10. And if you are a desk jockey and you spend long periods hunched over, you may find that all of this tightness in the lats, because you are hunched in that flexion all the time, you may find this one really tricky. So you could always just bring the arms out slightly, but the closer the bicep is to the ears, the better and more beneficial it is. So you've got a couple of little modifications and progressions there. Okay, from that one I'm going to roll over onto my back and we are going to look, onto my side, and we're going to just look at a little thigh stretch. So I'm just going to grip for the foot there, for the ankle, and I'm just bringing this knee back in line with the other one. Find my little biting point, hip and thigh. I'm going to do that 3 times, a little bit further each time. And on that third one, I'm just going to hold it for a breath. Try not to strain, no gurning, just relaxing into this tension. Brilliant. So from this angle, gripping, easing it back in line with the left. If you're really tight in the thighs and you can't reach there, I would suggest, third one I'm going to hold, I would suggest revisiting some of the earlier mobility routines we've got. If you're really struggling to even grip your ankle there, as mentioned, that will be tight hips, tight thighs. That will be why you are experiencing those niggles. But prevention is the best solution, so as I say, if you're active or sedentary, give this one a go and you're going to find it beneficial. Right, so in one of the earlier ones we did the 2-footed hip raise, glute bridge. So this time I'm going to do a single leg one. So from this angle, right across the left. Now this is a good teller as well. If you've got really tight piriformis, this knee will want to kick out like this. If that's tight glutes lead to back issues. So I'm going to try and keep it square and I'm going to lift and squeeze. Weight on the heel, weight on the shoulders, activate your glutes, really tense them, and I'm going to lower under control, lift and squeeze. You may feel a bit in the hip, in this piriformis. So, they're all there, and you can just find out where your imbalances are, because one side will feel tighter than the other. So now I'm going to switch, and as you'll see, this one isn't as tight. A lot easier to keep it square. So we just lift and squeeze. For 5. Now all I'm going to do is going to bend both knees, and I'm just going to reach. I'm going to do a little bit of hamstring, back of the thigh here, gripping. And again, if you're really struggling tight to get there, you want to revisit some of the early ones that have got modifications, and they're also towel assisted, so you can use the towel. About 5 of these, or 3 to 5, and then I'm going to hold. So it's all kind of dependent on time really, and how tight you are. If you're really tight, you want to spend a lot longer on it. And if you're short for time, just do the bare minimum. But
but get them done. Right, next one, adductors. Feet together, let gravity do its job. But all I'm going to do, so inner thighs, if that's really tight, you can just leave it there. But from there, all I'm going to do is I'm going to drop the right one, pick up the left one. Drop the left one, pick up the right one. Alternate 6 or 10, 3 to 5 each side. Brilliant. And then from there, the last one is the knee drops again. So on the very earlier one we did just standard knee drops, looking up. So the key is keeping the shoulders on the mat, right angles, tuck the knees in, dropping the knees to my right. But what you don't want to do is roll this left shoulder. So from this angle, I'll drop them to the right. Keep looking up. So what I'm saying is the key isn't to get the knees to the mat. If this is happening, the goal is to keep both shoulders on the mat and just go as far as you comfortably can, and over time you will get the knees to the floor, but don't force it. So ideally we want to alternate these. I'm just demonstrating. Now, our little progression on this is the head move. So as I drop the knees to the right, I'm going to look to the left. And vice versa. Drop it to the left, look to the right, keeping the shoulders on the mat. So I'm just looking up so you can see what I'm doing. And with these knee drops, you want them tucked in like a right angle, not out here. Tuck them in here, tuck them in. And I'm going to drop to the left, look to the right. All up the sides here. Drop to the right, look to the left. And that is it. That is the last one. So there you have it. There is today's back care routine. Give that a go, and I'll catch you on the next one.